Hello dear students, myself Bhavani Pentela, working as an assistant professor in Noida Institute of Engineering and Technology, Pharmacy Institute. In my previous class, I had covered about sedatives, hypnotics and central acting muscle relaxants part 1. So, in this lecture, we will cover part 2 with the pharmacological actions and central acting muscle relaxants. So, without any further delay, we will dive into the class. In my previous lecture, just I had said you, we had covered what is a sedative and what is a hypnotic, what is the major difference between sedatives and hypnotics, and after that we had covered the sleep patterns, REM sleep, what is the REM sleep, what is the non-REM sleep, right. So, what is the major difference between the sedatives and hypnotics? Both are the CNS depressant drugs, both will depress the respiratory system, but what is the major difference between the sedatives and hypnotics? The major difference was sedatives are the drugs which will produces calmness and it will decreases the excitement without inducing the sleep, but the hypnotics are the drugs which will reduces the excitement and it calms the patient, which will induce the sleep as like the normal sleep. This is the major difference between the sedatives and hypnotics. Most of the drugs at low dose can act as a sedative and high dose it can act as a hypnotics, right. And after that we had studied about the sleep patterns like REM sleep and non-REM sleep. What is the major difference between the two sleeps? In non-REM sleep we can see the parasympathetic innervation, in REM sleep we can see the sympathetic innervation. And what is the major difference between these two we had covered in the previous class. If you have any doubts, let us go with the previous lecture, right. And after of that we had covered the classifications of sedatives and hypnotics. So, how many types of sedatives and hypnotics has been classified? In that we had covered the selective benzodiazepines, GABA receptor agonist drugs, non-selective non-benzodiazepines, GABA receptor agonist drugs. So, these are the two classifications we had studied in detail in the previous class. So, what are the selective benzodiazepines drugs? In that we will study about the benzodiazepines and non-benzodiazepines. What about non-selective drugs? In non-selective drugs we will discuss about barbiturates and non-barbiturates. In previous class we had covered about the mechanism of action as well with the entire diagram. So, we had discussed about the benzodiazepines mechanism of action and barbiturate mechanism of action. So, what is the major difference between the mode of action between these two hypnotic drugs? One of the drug will increases the frequency of chloride channel. Which drug will increases the frequency of chloride channel? Benzodiazepines. Benzodiazepines will increases the frequency of chloride channel. What about barbiturate? Barbiturate will increases the lifetime of chloride channel. This is the major difference between these two drugs. One is selectively will bind to the GABA receptor and one is non-selectively bind to the GABA receptor, and both will having the sedative and hypnotic action. It will depresses the cell, right. So, today in class we will discuss about the pharmacological actions of sedatives and hypnotics. So, in this class we will study about the CNS. What is mean by CNS? Central nervous system. So, after taking of these sedatives and hypnotic drugs, what is the action on central nervous system? So, benzodiazepines are less neuronal depression. If I am talking about the benzodiazepines, these are the drugs, this is the drugs which will cause us the depression as like hypnotic drugs, but the major difference of these two drugs, it has in less neuronal depression compared to that of a hypnotic dose, right. Benzodiazepines are the drugs which having the less neuronal depression. If I am talking about the barbiturate drug, in these slides I am giving in comparison between the benzodiazepines and barbiturates pharmacological action. So, benzodiazepines are the drugs which having the neuronal depression in somewhat less manner, but if I am talking about the barbiturate drugs having the neuronal depression in a high manner. So, the neuronal depression will be high with the barbiturates and it will be less with the benzodiazepines. And what is the next one? Cardiovascular system. So, what is the action of benzodiazepines on cardiovascular system and what is the action of barbiturates on the cardiovascular system? If I am giving in a high dose of benzodiazepines, it can causes the bradycardia, it can decreases the heart rate. And what about the barbiturates? If I am given in a moderate dose or in a therapeutic dose, it can induces the bradycardia, it can produces the heart rate, decrease in heart rate. So, this is the difference. This is the difference between the benzodiazepines and barbiturate. The barbiturates having somewhat greater in action as a hypnotic drug, right. And after that we will discuss about the respiration. So, both of the drugs like benzodiazepines and barbiturates both will depresses the respiratory system, but benzodiazepines will depresses the respiration somewhat in high dose and barbiturate drug will depresses the respiration in a therapeutic dose, right. And what about the muscle? And these both drugs will causes the muscle relaxation. Whenever you had given these both drugs, both sedatives and hypnotic drugs like benzodiazepines and barbiturates, both will relax the muscle. Which type of muscle? Skeleton muscle. It will relaxes the muscle, it will relaxes the skeleton muscle. Okay. And if you are using the long term purpose, benzodiazepines will be the safe drug compared to that of barbiturate. Why it is a safe drug? Because it having a high therapeutic index compared to that of barbiturate. Why the barbiturate is more toxic than benzodiazepine? Because it having the low therapeutic index. So, in this slide we have covered what is the drugs acting on CNS, CVS, and after of that respiration and muscle, and we had discussed about the long term use. And after of that, sedatives and hypnotic action. So, if I am discussing about these both drugs comparison, so both drugs will reduces the anxiety, both drugs will calms the patient, both drugs will reduces the excitement, but both drugs will having in a equal distribution as an sedative and hypnotics, right. And after of that, if I am talking about any hypnotic action, so benzodiazepines at hypnotic action, it will produces the drowsiness and sleep. And the same barbiturate also at a hypnotic dose, it can produces the drowsiness and sleep. And what about liver? If I am talking about these two drugs, benzodiazepines and barbiturate, barbiturate is a potent enzyme inducer. What is an enzyme inducer? Enzyme inducer is an enzyme inducer, it means it can induce the enzyme and it will increases the metabolism of the drugs which you had taken with this drug, right. If you had taken the barbiturate and along the barbiturate you had taken some other drug or second drug or third drug. So, the barbiturate is an enzyme inducer, it will induces the enzyme, it will increases the metabolism of the rest of the drugs and the rest of the drugs will be eliminated from the body very soon. Okay. So, if I am talking about these two drugs, enzyme inducer, barbiturate having a potent enzyme inducer. Yes, benzodiazepines is not an enzyme inducer, but only one drug. What is that drug? Chlordiazepoxide. Okay. What is the drug name? Chlordiazepoxide. The only benzodiazepine drug chlordiazepoxide having the potent enzyme inducer. Okay. And what is the margin of safety of benzodiazepines? The margin of safety was very high for the barbiturate, for the benzodiazepines drugs. The margin of safety is very low for the barbiturate drugs. Okay. And what is the abuse rate of benzodiazepines? The abuse rate of benzodiazepines very low. The benzodiazepines cannot produces the abuse. But what about the barbiturate drug? Barbiturate drug will produces the abuse. Okay, it will having the high abuse rate. And what about the sleep? Next one is sleep. If I am talking about the sleep, no effect on the REM sleep. The benzodiazepine drugs, when you had given, when it bind to its GABA receptor, it won't show any action or it won't show any disturbance in the sleep like a REM sleep. Okay? And if I am talking about the barbiturate, it will suppresses the REM sleep. So, it will suppresses that. In the previous lecture I had discussed about what is the REM sleep and what is the non-REM sleep. What is the REM represents here? Rapid eyeball movement. This is for duration 5 to 10 minutes, 5 to 20 minutes, right. So, this is the duration of 5 to 20 minutes. In REM sleep you can see the sympathetic outflow. Here you can see increase in blood pressure, tachycardia will be found in this REM sleep. If you are taking the barbiturate drug, it will suppresses the REM sleep, but there is no effect of benzodiazepines in the REM sleep. Right. And what is the next one? Anticonvulsant action. So, the both benzodiazepines and barbiturates having anticonvulsant property. Both drugs can used as a convulsant to treat the convulsions, right. And what is the dependence action of the benzodiazepines and barbiturates? If I am talking about benzodiazepines, is very less physiological and psychological dependence. If I am talking about the benzodiazepines, it having the less physiological dependence, less psychological dependence. But what about the barbiturate drug? Barbiturate drug having the high physiological dependence and high psychological difference. So, this is the difference between the both drugs. And we will move to the adverse drug reactions of any benzodiazepine drugs. So, what is the major adverse drug reaction of the benzodiazepine drugs? Benzodiazepine drugs is a well tolerated drug, first of all when you compare with the barbiturate, right. And this drug can produces the fetal respiration depression. So, when you are given this drug to the patient, it will causes the fetal depression, it can depresses the fetal respiration. This is one of the adverse drug reaction with the benzodiazepines. It can produces the drowsiness, it can impair the motor coordination. जो motor coordination if you given this drug, it can impair the motor coordination, it can produces the daytime sedation. So, this drug is not preferred to give on the daytime. When you had given at the daytime, this drug will induces the sleep, it will causes the sedation. So, daytime this drug will produces the sedation, and if you had given this drug or if you had suggested these drugs in elder people, it causes somewhat anxiety. So, in elder people, when you are giving this drug benzodiazepines to the elder people, you have to take somewhat caution, because it will causes anxiety when you had given in the elderly person. And after taking of this drug benzodiazepines, somewhat you can see the behavioral changes, but not much more. You can see the somewhat behavioral changes. If I am talking about the barbiturate, it will shows the more physiological and psychological depression, some more physiological and psychological behavioral disturbances you can see with the barbiturate, but compared to that the benzodiazepine is somewhat less, but it can produces the behavioral changes. And what will be seen here, and if you taken this drug, it can causes the leukopenia and allergy and vertigo. What is mean by leukopenia? The leukopenia term represents decrease in white blood cells in the blood. Right, leukopenia, it is a decrease in number of white blood cells in the blood is called as a leukopenia. If you are taking this drug, rarely, very rarely it can causes the leukopenia. And what is an allergy? It is an allergy is like any skin rashes or any form of any hypersensitive reaction. Okay, and it causes the vertigo. What is mean by vertigo? Vertigo is a sudden internal or external spinning like feeling, right. If you are taking this drug, the drug can produces the sudden internal and external spinning feel when you had rotate the head in sudden. This is the main drawback with this benzodiazepine drugs. After withdrawing of this drug, withdrawal symptoms will be seen with the benzodiazepines. When you had withdrawn this drug, it can produces the insomnia. What is mean by insomnia? Loss of sleep. If you are stopping this drug, all of a sudden the withdrawal symptoms will causes the insomnia and causes the agitation. These are the major drawbacks of the benzodiazepine drugs. And next we will discuss about the adverse drug reactions of barbiturate drugs. So, somewhat adverse drug reaction is more compared to that of benzodiazepines, and we will discuss what are the major adverse drug reactions of barbiturates. Barbiturate drugs are intolerance drugs. It can produces the excitement, it can produces the headache, it can produces the diarrhea. All these are the major symptoms which you can see with the barbiturate drug. Apart from that, it can causes the allergic reactions. So, after taking of this barbiturate drug, it can induce the allergic reactions. So, a lot of allergic reactions you can notice here: urticaria, angioedema. Okay, agranulocytosis is also one of the adverse drug reaction you can found with the barbiturate drug. Thrombocytopenia. Okay, these are all the adverse drug reaction you have observed with this barbiturate drug when you had given to the particular patient. Okay. So, if you see this one, urticaria, what is mean by urticaria? It is an allergic reaction, it is an hypersensitive reaction. Thus, you can see in urticaria, you can see the skin rashes on your skin. So, it is called as an urticaria. It is like an allergic reaction. It may be happens due to because of food, it may happens due to because of drug or any some other irritants when you had exposure to the body. It can causes the urticaria, right. And what is mean by angioedema? Angioedema, it means simply you can say the swelling beneath the skin. So, you will say edema. Edema is the meaning. What is the meaning of edema? Swelling, inflammation. So, you can see somewhat swelling on the beneath the skin. So, this is called as an angioedema. And what is an agranulocytosis? What is an agranulocytosis? Agranulocytosis, granulocytosis is a very serious problem. It is a decrease in the granulocytes. If you say the decrease in number of granulocytes in the blood, okay, if you see the number of granulocytes present in the blood has been decreased, then you can call as any agranulocytosis. It is a serious problem. It is one of the white blood cells which are present in your body, which is helps for which helps for your immunity system for fighting with any microorganisms, such as it helps in the immunity process. Okay. So, and what about the thrombocytopenia? The thrombocytopenia is also one of the adverse drug reaction which you can see with the barbiturate drugs. Apart from drug, it can produces the megaloblastic anemia. What is mean by megaloblastic anemia? Megaloblastic anemia is one type of an anemia. It is a blood disorder. right. It is a blood disorder, decrease in the red blood cells in the blood, you can call it as an megablastic anemia. And one more, the major adverse drug reactions with the barbiturate, what it can cause is the fetal depression, fetal respiratory depression. So, same like benzodiazepines, barbiturate drug also will causes the fetal depression, fetal respiratory depression. Okay, and before going to the central muscle relaxant, I have to discuss about the few points here. What is the major difference between the benzodiazepines and barbiturates? If I am comparing these two drugs, the relatively safest drug was benzodiazepines. Why it is a safest drug? Because it induces the sleep as like a normal sleep, it can give the peaceful sleep. It can give, after taking of this barbiturate drug, it can give the peaceful sleep, it can produces the refreshing sleep. So, it is more preferred than that of a barbiturate. And one more advantage of benzodiazepine was it having very high therapeutic index and it having less toxicity, and the drug interaction also is very less to the benzodiazepines compared to that of a barbiturate drugs. So, these are the major advantages with the benzodiazepines than that of a barbiturate. So, this is the common using drug to treat the sedative and hypnotics compared to that of an barbiturates. So, it induces the sleep and it is more refreshing sleep, and even it can reduces the pain. It can reduces the pain in the sleep, and it can having very high therapeutic index, it having less toxicity, and this is the drug which you had given, which you had preferred much more than that of a barbiturate drug. For example, if you had taken the hypnotic dose of a barbiturate little bit more, if you had taken in a high dose of a barbiturate drug, what is going to happen? Because the barbiturate is in such a drug which having the low therapeutic index. So, if you had somewhat increase in a dose, it can increase in the toxicity, right. So, because the barbiturate is in a drug which having the low therapeutic index, it having the margin of safety is very low. If you slightly increase in the dose, it can causes a toxicity in your body. So, if you had increased the little more dose, or if you had given a high dose of an hypnotic dose to the patient, so what is going to happen? It is going to happen barbiturate poisoning will be seen in your body. So, what you have to treat here? What is the main treatment you have to give when the barbiturate poisoning has been happened in our body? So, we have to first we have to go with the gastric lavage, and after of that you have to give the intravenous fluids, and you can treat like dialysis, forced diuresis, right. These are all the treatment you can given with the barbiturate poisoning, and you can give the prophylaxis of antibiotics. So, these are all alkalization of urine also one of the treatment you have to do when the barbiturate poisoning has been seen. So, these are all the barbiturate poisoning treatments. Okay. So, now we will move to the central acting muscle relaxants. What is the major difference between the central acting muscle relaxants and peripheral acting muscle relaxants? Both are the drugs which will relax the muscle, but one of the drug will relax the muscle through acting centrally, and other one will relax the muscle by acting on peripherally. If I am talking about peripherally muscle relaxant drugs, you can see the depolarizing and non-depolarizing drugs. So, it is not in our topic right now. So, we will concentrate on the central muscle relaxant drugs. So, what are the central muscle relaxant drugs? Central muscle relaxants are the drugs which will decreases or which will reduces the skeleton tone without altering any consciousness. It cannot alter any consciousness, it will cannot lose the consciousness, but it will reduces the skeleton tone, it will decreases the skeleton tone. Okay. So, when you are taking these central acting muscle relaxants, most preferred route was oral, but you can given sometimes you can given parenteral route also. So, these are the drugs which will depresses the spinal and supraspinal polysynaptic reflexes. Whenever you had given the central acting muscle relaxant drugs, these are the drugs having capable to decrease the to decreases the spinal and supraspinal polysynaptic reflexes in the CNS, and it having no effect on the neuromuscular transmission. It cannot show any effect on the neuromuscular transmission. What the drugs is going to show the effect on neuromuscular transmission? Peripheral acting muscle relaxant, but the central muscle relaxant will won't show any action on a neuromuscular transmission. These are the drugs which you can given by oral and sometimes it can preferred by the parenteral route also. So, what is the classification here? What are the drugs you can study here? So, one is Mephicin conjugators, second one is Benzodiazepines, third one is GABA derivatives, and fourth one is central alpha 2 agonist drugs. These are the four category of drugs you can given in the central acting muscle relaxant. These are the drugs which will relax the muscle tone. So, what are the drugs will relax the muscle tone? First one is Mephicin, Metacarpal, chloroxazole. So, chloroxazone, these are the drugs which comes under Mephicin conjugators, okay. And you can use the benzodiazepine drugs, diazepam or any other diazepine drugs, any other benzodiazepine drugs, you can use it to decreases the skeleton tone, right. You can use the GABA derivative drugs like baclofen. Baclofen is a GABA derivative. You can use this drug as a central muscle relaxant drug. You can use the alpha 2 agonist drugs. What is the alpha 2 agonist drug? Alpha 2 agonist drug was what is the drug? Tizanidine, okay, Tizanidine is the drug which you can use here, right. So, if I am talking about this drug, first I am discussing about the Mephicin. Mephicin was the first muscle relaxant has been proved in the animals. When you are checking the activity on the animals, it had showed the muscle relaxant activity. It is the first drug which had showed the muscle relaxant activity on the animals. It is used as a counter irritant on animals. It is the most important use of this is it is used as a counter irritant ointment, okay, counter irritant ointment you can use in the counter irritant ointment. What is the major clinical use of this Mephicin drug? Clinically it is not used. The clinically yes, clinically it is used to used as a central muscle relaxant, but nowadays this drug is not preferred clinically because of GI irritation, and after taking of its drug it will cause a sudden decrease in blood pressure and hemolysis. What is hemolysis? Destruction of blood. So, okay, this when you had given on intravenous, it will causes the hemolysis. So, these are the major drawbacks with of this drug. So, this drug is not clinically used nowadays, right. And next one, Metacarpal. Metacarpal is also a drug which having the less sedative and longer duration of action than Mephicin. So, compared to that of Mephicin, this drug we have somewhat therapeutically used. It can use it in the neurological disorder. If any person is suffering from the neurological disorder, you can given this Metacarpal drug to treat the neurological disorder. When you had given on intravenous route, it do not produces or it do not causes the hemolysis. This is one of the advantage of this drug. And next one, diazepam. So, what is a diazepam? Diazepam is a benzodiazepine drug. It will enhances the GABA action, it will enhances or it will promote the GABA action, and there will be no gastric irritation with this benzodiazepine or diazepine drug. And next one, GABA derivatives drugs like baclofen. The baclofen is a GABA derivative drug. It is selectively it is a GABA B drug. If I am talking about GABA, we having three types of receptors, namely GABA A, GABA B and GABA C, right. If I am talking about the first receptor GABA A and the last receptor GABA C, both are ion channel receptor, and the center one like GABA B receptor, it is a metabotropic receptor. If I am talking about this one baclofen, it is a selectively GABA B receptor agonist drug. It is a metabotropic receptor. It is a J protein coupled receptor. It is a GPCR receptor. It will shows its action by GPCR, right. It hyperpolarize the neuron by increasing the potassium conductance. How it will causes the hyperpolarization? It will increases the potassium conductance. So, by increasing of this potassium conductance, it will causes the hyperpolarization of any neuron. It depresses the both polysynaptic and monosynaptic reflexes. So, this is the drug like baclofen, which is a GABAergic derivative drug which can depresses the both polysynaptic and monosynaptic reflexes. It having less sedative action compared to that of diazepam. If I am talking about diazepam is having a very high sedative drug. It is used as a sedative drug. It having somewhat more sedation. But this GABA derivative drug like baclofen, this drug having the less sedative than that of a diazepam. So, what are the uses of these central acting muscle relaxants? Those central acting muscle relaxants you can use in the like that you can use it in the muscle relaxant property. So, this is the drugs which can decreases the muscle tone, right. You can use it as a muscle relaxant. It can decreases the anxiety. Somewhat most of the drugs having the sedative in action. So, most of the drugs or almost all the drugs of the central muscle relaxant having the sedative action, but it depends depend the drug to drug, which drug having the more sedation and which drug having the less sedation, but all the drugs having the sedative in action, right. It is used in anxiety. Second use is it is used in anxiety. So, if any person having anxiety, so to treat the anxiety or to decreases the anxiety, you can give the central acting muscle relaxant drugs, okay. And it can use it in the electroconvulsive therapy. So, it can use it in the electroconvulsive therapy if any person having the convulsions, to treat the convulsions. So, in this convulsion therapy, you can use these central acting muscle relaxants, and you can use as an tetanus. In tetanus, you can use as an tetanus. In tetanus also you can use these drugs. So, in this today's session, we had covered about the pharmacological actions of hypnotics and hypnotic drugs like benzodiazepines and barbiturates, and after of that we had discussed about the adverse drug reactions of barbiturates, adverse drug reactions of benzodiazepines, and why we preferred benzodiazepines more than that of the barbiturate, and we had discussed about the poisoning effect of the barbiturates. What is the major treatment for the poisoning when we have when the particular person induced the barbiturate poisoning, and after of that hypnotics and sedatives drugs, we had moved into the next topic, central acting muscle relaxant. So, this is about the today's session. Thank you.